Welcome. I'm Dr. Thema Bryant-Davis, licensed psychologist, researcher, and professor at Pepperdine University, as well as a candidate for president-elect, the American Psychological Association. I'm so glad you're here on today as we're going to discuss the mental health of children, considering trauma, loss, and oppression. I have two wonderful guests with us here who have expertise in working with diverse children, and I want to introduce them to you now. The first one is Dr. Sawssan Ahmed. He's a licensed clinical psychologist and an assistant professor in the Department of Psychology at California State University, Fullerton. Dr. Ahmed's research focuses on the relationship between sociocultural risk and protective factors and physical and mental health in people of color, with a specific interest in American Muslim and Arab American communities. As a clinical psychologist, her expertise lies in providing evidence-based interventions that are supported by clinical research and ensuring they are culturally appropriate. So important. She is currently leading a research project to study an ethnically diverse sample of American Muslim emerging adults and adapting an evidence-based psychological intervention to prevent postpartum anxiety and depression in pregnant Arab women. She is also the American Arab, Middle Eastern, and North African Psychological Association's representative to the American Psychological Association's Council of Representatives. Welcome. Thank you so much for joining us on today.
Thank you, Thema.
Here you go. Yes. We're glad you're here, and I want to introduce our next expert, Dr. Earl Turner, who's also a member of our dream team. Dr. Earl is a clinical psychologist and an assistant professor of psychology at Pepperdine University in the Graduate School of Education and Psychology. His research expertise primarily focuses on mental health among racial and ethnic communities, access and behavioral health services, and the impact of race-based stress. Recently, he founded Therapy for Black Kids, an organization dedicated to helping parents address racial injustice and foster resilience to promote healthy development. Dr. Turner is a nationally recognized mental health expert and has been quoted by top media sources, including the New York Times, Washington Post, Ebony, Oprah Magazine, NPR, NBC News, and more. He is the author of Mental Health Among African Americans, Innovations in Research and Practice, and is the past president of APA Division 37, the Society for Child and Family Policy and Practice. Welcome, Dr. Turner.
Thank you for having me.
Oh, I am so glad that both of you could join us. It is such a priority of mine and my platform to look at the experiences of children and youth, and especially in the times that we are living with. So I want us to really start with that context and ask you both what effects, whether in your research or your practice or consultation work, have you observed among children as a result of them living through COVID-19? And I'll start with you, Dr. Ahmed.
Sure. So I think some of the things that we're seeing in kids are kids being more withdrawn because they've had such a long period of time of lack of social interaction because of the pandemic and the COVID-19 pandemic, and because of virtual learning, and there being like chaos in their schedule. Some virtual learning is on, then it's off, then it's on, and things being constantly changing, and that lack of routine can create just a lot of anxiety and symptoms of a feeling of withdrawn and feeling uncertain about what's to expect from the world. And you think about adults being struggling, children are going to struggle more because they're looking for, they need that limit setting, they need that routine in the environment to feel safe. I think we're seeing some somatic complaints, and we know that we have to remember that children often have different ways of showing mental distress, that they may not have the words to kind of describe how they're feeling. So their symptoms may be coming out in somatic complaints, and that along with the symptoms of the virus together can create kind of an interactive kind of effect in what we're seeing in kids. And then I think also we have to remember that all of this is existing in the midst of an existing traumas and oppression. So the pandemic, the COVID-19 pandemic didn't, come from nowhere, or just everything wasn't okay when it came. So we have to keep that in mind as well. And I also just wanted to point in before getting to Earl, because I want to have him to talk, his chance to talk, but I think there's some positive effects that we're seeing from the COVID-19 pandemic specifically. For example, families are spending more time together. People are being allowed that flexibility to work from home, and that they wouldn't have had otherwise, and which, a lot of parents have been asking for a long time, so that they can kind of design their own schedule, spend more time with their children. And I think, a lot of virtual learning, while it has a lot of challenges, it may be easier for some kids who have social anxiety and who are introverted. And then also there's less bullying, especially when we think about younger kids who don't have as much access to social media and bullying through the internet. We're hearing a lot about them enjoying the virtual learning and not being out and being around a lot of people because they're facing less bullying. So I think we need to look at both the negative and positive effects.
Oh, thank you so much for naming that and bringing attention and space for, the benefits as well as the negative consequences, and also naming that for many young people, while COVID-19 can be devastating, it is not their first exposure to a trauma or to oppression. Dr. Earl, what are you noticing?
Yeah. So I'll start off with the positives to piggyback off of what was already mentioned by Dr. Ahmed. And so one of the things I think for a lot of kids, specifically those that are within the LGBTQ community, is that because of being away from some of the bullying, that they also have experienced sort of better adjustment over the last year during the pandemic, because of not having to be worried about those concerns. On the flip side, for some of those kids, home has also been difficult for them, and so not having that safe space, not being able to be sort of as open with their family about their sexuality, has also added to some of their stressors and some mental health concerns for that particular population. And then just to sort of add off of what was already mentioned, I think there's a lot of data that has been come out over the last year, and obviously we'll know more as time goes on, in terms of what we're actually seeing with kids and some of the struggles and the difficulties that they have experienced over the pandemic. And so there was a study that came out recently, a couple months ago, in the Journal of Adolescent Health, that really looked at sort of how has the pandemic impacted youth, and sort of just to support the information that was discussed earlier, really looking at for kids having these increased stressors related to the pandemic. Many kids struggling with school concerns. So although things sort of shifted for a lot of kids to be at home and do school virtually, that also added difficulties with too much work. And so, how to manage their time effectively in those environments. And so I think that has created a lot of difficulties for kids that we will continue to see sort of unfold over the next year. And also mental health challenges. So as was already mentioned too, that many kids have experienced increased stresses and anxiety around the pandemic, being self-conscious about a lot of things related to school and academics and sort of their future. We saw children that were sort of graduating from high school, and what their concerns were about not being able to engage in some of these milestones that are typical at that age, that also added to some increased depression and sadness among that particular population. And then concerns about socializing. And so not being able to see their friends as often and missing their friends, and having fear of losing contact because they were so disconnected due to some of the restrictions around physical distancing. So I think those are a lot of challenges that we've seen over the last year, and that we're going to see kids have some difficulties trying to sort of readjust back to the school environment and being in person.
So important. I appreciate these issues that you all have raised, and I think as we consider the children, thinking about the family as well, and knowing those increased risk or increased rates of intimate partner abuse, the increased stressors, especially for single working mothers, the challenges that parents who have reported who have children with special needs and not feeling equipped or prepared to be able to provide their child the resources that they need. And then for many young people, a protective factor has been sports or other activities. And so when they did not have access to that, there can be that sense of depression or isolation, as you all are naming. I will say that in this time, we have seen a lot of creativity and innovation. Who knew you could do a whole summer camp online, right? Or family reunions online. So we have been trying. My son was even in a martial arts class that switched to online. So it's like, could you learn martial arts on Zoom? I guess so, right? So as we think about our diverse children, and particularly racially and ethnically marginalized youth, we know that many of those communities and families faced increased risk of death and severe consequences and hospitalization from COVID-19. And so children have had to face loss, many of them. And I think it's important to consider not only the tangible losses in terms of death of a loved one or death of a friend or a teacher, but there have also been some intangible losses. And I wonder if you both could speak to that, Dr. Ahmed.
Sure. Yeah. So in addition to the tangible losses that you just mentioned, Dr. Thema, I think that there's these intangible losses, like for many BIPOC children in many communities and immigrant communities, there's a lot of multi-generational households or grandparents involved in parenting, in care, and helping with homework, things like that. That is now more difficult. Yes, it can be done online, but it's a lot of communities, a lot of families are choosing to stay away from their elders because they want to protect those elders because they are more at risk for death and severe illness from COVID-19. And I think that's a big loss, I think, for children and families, is having, that, or, aunties that are usually involved in, the village that usually is there around helping kids out, teaching them about day-to-day activity, day-to-day getting by, and also things like tangible, like homework. I think that's a big loss. And then, as sort of Earl was mentioning, loss of access to resources that schools usually provide. Like schools can be a safety net for many children because their families may not be accepting of them, like you mentioned, Dr. Turner, and so they losing that. And school can be access to meals. It can be access to technology that may not be available at home, mentorship that may not be available at home. So that, I think that's a big loss for children. And then lack of access also to just spaces where children can get physical activity, especially in places where the climate, is either too hot or too cold. Not in California, where we're all from, but it's a lot of places. I think, that's something to keep in mind. I know where I am right now. Their extreme heat means a lot of families had to keep their children indoors, and there was nowhere for children to go, and that was a big challenge for families. So those are some of the intangible losses that I think children are facing.
Yeah, so important to name. Because sometimes if people say, "Oh, no one in our family has died," they should be fine, right? And Dr. Turner, any others come to mind?
Yeah, so I agree with the tangibles that you mentioned in terms of, family members, friends, relatives, teachers that have passed away due to COVID. I think other tangible losses, sort of going back to my point that I mentioned earlier, or being able to, not engage in some of these milestones in terms of going to school activities, school dances, proms and graduations. I think for a lot of, particularly adolescents, that those were huge losses that they faced and had some difficulties coping with over the last year. I think it's some of the intangible losses, time in school. Like school is really important. And I know that for many people, as we sort of transition back to either in person or some sort of hybrid version of school for kids, that also is going to impact them in different ways. So one on the sort of interpersonal level in terms of friendships, and we know how important that is in terms of the connection that they get through those relationships, but also the skills that they learn in terms of those connections with working with friends and all of those things that sort of transition on into their adulthood as well. And so I think that being able to have that sort of absence in school is also going to sort of impact them in multiple ways, as we will see unfold over the next few years. And then I think, in terms of school, the academic pieces that were lost. And so I think specifically for BIPOC youth or children that are in under-resourced communities, that we know that schools already struggle to sort of meet their needs academically. And so those kids are also going to be at a much higher risk in terms of, where they are in terms of meeting these sort of benchmarks academically. And so I know there have been some concerns around sort of the importance of like standardized testing and how much weight we should place on those. And so as kids sort of transition back to school, like they've lost a lot over this last year. And I know that for, some of my friends that I know have kids, being able to like be teachers to their children, like the way that, math specifically, I think, was taught when we learned it much different. And so that they're getting a different skill level of education that they may have gotten if they were, in school. And so I think that those are also some intangible losses that have occurred over the last year. And then the last thing I think for me is really having conversations around social and emotional skills. And so I think that being able to sort of cope with these difficulties, that most kids struggle with that. And so they need to have, role models and parents that are also able to sort of navigate those things and show them and model for them how to cope. And so we know that for many adults and parents that they've also struggled throughout the pandemic. And so that's been added pressure for them to, to take care of themselves, but also demonstrate for kids the tools that they need to be able to sort of help them navigate these, uncertain situations in life.
Yeah, so important. And as you were talking, I think about children also trying to make meaning or come to a place of understanding with the fact that families have different rules, and so some families are more cautious as it relates to the pandemic and may say, like we're not doing anything. And then they look up or talk to a friend who's like going here, there, and everywhere. So it can feel like, like the why can't I, or everyone else is doing it. And also thinking about children who are immune compromised, are also feeling left out in a particular way because of needing to be careful, to be safe. So there are many consequences when we think about loss. We can think about traumatic loss. We spoke about the medical trauma of COVID-19. We know that children can be exposed to a range of trauma types from child abuse, physical, sexual abuse, those who've been exposed to war, the realities of witnessing intimate partner abuse, or for some of our youth, dating violence themselves. And you all mentioned bullying as well. Another category of trauma that has often been overlooked is the trauma of oppression, and that oppression can lead to both stress and traumatic stress. And often, if we think about trauma, or if we name racism, heterosexism, classism, sexism, the picture that comes to people's minds is usually adults. And it's important to be aware that oppression also has an impact on children. And I would love if you both could speak to that. And I'll just shift it this time and start with you, Dr. Turner.
Sure. Yeah, I mean, so this is a really important thing that I think we need to continue having conversations about. So one of the things that I've been sort of doing more work around is understanding how police violence impacts individuals. And so obviously I think for families and for kids that has a huge impact in terms of their overall mental health. And so we've seen where there's sort of these indirect exposures, obviously, if kids are sort of witnessing their parents encounter some of these interactions with police, that it can also make them more fearful about their parents leaving the home or their own safety. And then I think for kids that may sort of see these things in the media or on social media, that also can have an impact in terms of their overall mental health as well. Some of the symptoms related to PTSD, or post-traumatic stress disorder, in terms of, flashbacks or increased alertness that may show up for them as well. And then I think a huge part that we need to really think about is how kids experience racism and discrimination within the school system. And so, kids spend a huge amount of time within the schools. And my colleague who is at Howard University and another colleague, we just published a paper in psychology in the schools that really sort of talked about how, kids experience these microaggressions and racism and discrimination into school from, their teachers as well as from their peers. And that oftentimes many of those kids are not getting any type of mental health treatment or services. And so data shows about 75 to 80% of kids are not getting help. And so we know that if you're not treating these difficulties or this trauma related to oppression and racism, that it can have a huge weight in terms of, depression symptoms, anxiety symptoms, their decreased self-worth. And so these are some of the things that we need to talk about in terms of how does oppression and discrimination impact youth.
Thank you. And so important to consider that those range of symptoms of distress, right, that can show up. Dr. Ahmed.
Yeah, and I think in addition to what Dr. Turner said, a lot of really important things. I think that I think it's important to look at oppression from like a developmental perspective. So one of the things that I've been looking a lot at lately or thinking a lot about lately is that oppression has an impact on children as early as in utero. So because of its impact on parents and specifically mothers. So we actually have literature from, we have research from health disparities literature that tells us that, for example, mothers who've experienced racism have children who have lower birth weight, have lower APGAR scores, have difficulty interacting with their children. Their children might have worse child temperaments. And so it starts from early as that then, and that has a sort of a cyclical and interactive effect. So if you have a child who has lower birth weight, has medical issues, the way you interact with that child, or has a difficult temperament, it can make the mother respond in a less warm way. So that it sort of has an effect and an impact just as early as a baby, as an infant, and that goes along and throughout the trajectory of childhood up until adolescence that Dr. Turner was highlighting. And so I think we can start from there. And I think we need to study this more. We need to know how trauma and oppression affects, how mothers interact with their children and fathers as well. And even I think, and then we know that these things, vicarious trauma is very impactful as well. So even if children may not be experiencing directly some of these oppressions, they hear about it through their communities, they hear of their parents and their parents' friends and families talking about it, and they become scared and they become fearful. And then children who experience oppression, they may have difficulty with trust, they have difficulty feeling safe. You see these kind of PTSD responses that Dr. Turner was talking about, like heightened startle responses. They may be withdrawn. They may have a lack of hope. And and when you see children who have this kind of lack of hope is one of the biggest predictors of things like suicide, for example, is helplessness and hopelessness. And that's why we're seeing increased suicide rates in communities that face oppression as early as, and we're seeing in younger children. I think it's exactly because of these things going on. Children are sitting and they feel like they have no control over their lives. Nothing they do will matter. The oppression will still exist. The world is not fair. And those are kind of those are their real lived experiences. And so I think that's something to really think about. So this kind of developmental trajectory of oppression and how it affects babies up until adolescence. So those are some of the things that I've been looking at and thinking about a lot. In terms of how, and so, for example, there's a lot of, we're looking at, there's literature studying racism and in children and looking at racism in the schools, how it differs than, racism and in the community, and then also things like systemic racism and how obviously those impact children across the trajectory of development.
I am so glad you raised the prenatal aspect, right? And as you were talking, it made me also think about higher rates of maternal death, death just even in the birthing process, and racism existing in the medical field, in the healthcare field, in terms of even access or the way in which our pain is ignored or minimized. And then for both of you, when you speak about that institutional or structural racism, our education system, what children learn in schools about their community, right? About their cultural group and their contributions, not only their oppression and how often that gets diluted or overlooked in history or social studies. But when it comes to the other subjects, when great inventors and contributors to society are named, do they see their reflection there, right? Or in the media? And so that lack of representation also has an impact. So yeah, thank you both for speaking to that. And I know when we think of trauma, loss, oppression, those can all be very and are very heavy topics. And yet we all see among many young people a sense of both surviving or thriving or resilience. And so I wonder from you both some of the protective factors or coping factors that you see that help children to navigate these waters, and whether those are some of those factors are qualities that children are just born with, or if they are things that the adults that are working with them can enhance or help them to develop so that they can survive and hopefully thrive. Dr. Turner.
Yeah, I'm glad you brought this question up, because I think when we talk about, trauma, or a lot of conversations have been around adverse childhood experiences, or ACEs. And so I think really, one, to back up a little bit for people that are watching, to really be mindful of when we talk about trauma, is not always just like the physical sexual abuse or even emotional neglect, but just sort of witnessing, violence in the community, witnessing violence within, the media can also impact kids. Thinking about mental health challenges, whether they're family members that have a diagnosis that the kids may also sort of witness and struggle with, as well as other types of trauma with living in poverty and struggling, for parents struggling financially. That can also be a potentially traumatic experience for kids. And so what we see in terms of sort of protective factors and resilience is that for those kids that are able to be in spaces where it feels more stable. So even though they may be struggling, financially, if the parents are able to sort of navigate that in a way that the kids still feel safe and supported and feel nurtured, that can be a really helpful resiliency factor for those kids. And also making sure that they can maintain a sense of relationship. So we talk a lot about sort of the importance of sort of child-parent dyads and those relationships, and how important that is to overall wellness, but also thinking about relationships with peers. And so being able to strengthen those connections, and for kids to make sure that they at least have maybe one peer that they feel connected with and they have a friendship with, because what the research shows is that for kids that have sort of no close friendships or connections, that those kids are more at risk for not being able to navigate some of these challenges better. So being able to foster those things. And I've been talking a lot about that over the last year with the pandemic, that for kids, making sure that you try to be creative with maintaining some of those friendships and connections. And so for many people, using, Zoom and things like that to do like a game night or something like that have been really helpful for resilience. And then the last thing I think for some of BIPOC kids, and specifically Black youth, we've seen a lot of research around sort of racial and ethnic socialization. So being able to talk about the positive things related to their identity and their culture, and that has really been shown to be helpful to reduce negative concerns in terms of how they cope with racism and discrimination, but also how they deal with other challenges as being, a minoritized group in this country.
So important. And thank you for raising that, both the relationship and racial identity. Dr. Ahmed, are there resiliency factors or protective factors?
Sure, yeah. And one thing I always like to highlight when we talk about resiliency, because I think there's been a lot of focus in psychology on positive psychology and resiliency, which is important, because I think a lot of time oppressed communities are often, we just focus on the negative and we focus on problems. But before we talk about resiliency, I think it's also important to highlight that fostering or building resiliency in children doesn't mean that we're actually canceling out oppression or buffering the negative effects of trauma and oppression, because I think sometimes we put the responsibility of the individual, the child, or the parent, that you need to help your child, and you need to give your child the tools to deal with something that's greater than them. It's something that's systemic. And so I always like to highlight this when we talk about resiliency. And I study resiliency and I study protective factors, but I really want to highlight that as well, that sometimes the resiliency and protective factors, they are uniquely, directly related to positive psychological outcomes, but they don't cancel out or completely buffer out the negative effects of things like oppression and different types of oppression. So, and oppression and things specifically like racism, some of my research has found is that it's its own unique, specific type of stressor. Yes, you can study it in the context of stress, but it has its own direct effect on mental health beyond what general stress can affect mental health. But aside from that, let's get to the resiliency factors.
No, I appreciate you naming that. So important.
I always like to start with that, because I think then we put the responsibility on the individual when the problem is not outside of them, and I don't think that's fair. So, so some of the resiliency factors that I think that have been studied in the literature that we've seen is that can promote wellness and well-being in oppressed communities are things like, Dr. Turner already mentioned racial and ethnic socialization, but things like sense of community. So children who feel that they have, a community to go back to, a community that they feel connected to, tend to have better outcomes than children that don't. And this is especially important, I think of the pandemic and what sense of community is available, and how an online virtual community can be a community, but maybe it's not the same type of community. And also just as I think as Americans, we have a kind of a strange sense of community. Most of us don't know our neighbors very well. Maybe it's different in different parts of the country. But I think sense of community can be your neighbors. It can be that, or it can be bigger than that. So looking at, I think that's an important resiliency factor. I think spirituality is also a very important resiliency factor, and it's a form of healing and grounding. We talk a lot about mindfulness and psychology and how important mindfulness, which it is. We have a lot of research to tell us mindfulness is helpful. And mindfulness in children, for example, there's these interventions where they teach children yoga, and how that's even in communities that face oppression, and that's related to better outcomes. But a lot of times we talk about mindfulness devoid of spirituality. And for a lot of BIPOC communities, spirituality is actually a very important part of their daily lives. And it's fine to talk about mindfulness without spirituality, but we also should look at it in the context of spirituality if that's important for our communities. Because many of our communities and cultures actually have mindfulness practices already built in, and highlighting those and promoting those, I think, and the literature has shown that these things are, predict resiliency and better outcomes.
So important. And I just want to highlight and underscore what you were sharing, which is really that framework of liberation psychology out of Latin America, being an anti-oppression psychologist, an anti-racism psychologist. Many have talked about decolonizing or indigenizing psychology, paying attention to the systems and the structures. And I'd like to say that justice is healing, justice is therapeutic. So as you were naming, not just to say, how can we help individuals and families be stronger, but how can we shift and dismantle these systems of oppression, and to build communities and societies where everyone can really flourish, right? This from a even human rights perspective. And thank you also for naming the piece about spirituality and religion. Our research finds that on average, mental health professionals endorse lower spirituality and religiosity than the general public. So you have largely people without faith creating healing interventions for people of faith, and leaving out the ways in which they find meaning in the world. And that includes children, because I think for those who have very negative assumptions about spirituality and religion, they assume that children don't have spiritual lives. And it is very much not true, right? That can be both their interior life and also some of the benefits we see of being a part of a community or faith community. So thank you for naming that. Within child psychology, There are presenting problems that have been neglected, and there also are populations or communities that have been underserved. And I'd like to hear from both of you, just one either population or presenting issue that child psychology should pay more attention to, and why it would be important for us to do that. And I'll start with you, Dr. Ahmed.
Sure. So I think when I'm thinking about presenting problems, I think there's a lot of squeaky wheel gets the grease kind of issue in child psychology. And so a lot of child psychology has focused on, things that people see in schools, because that's so externalizing behaviors, things like ADHD, conduct disorder, behavioral kind of symptoms. And I think to the detriment of children who are experiencing depression and anxiety. And we know the depression and anxiety, we know anxiety is the most common psychological problem in the world, across cultures, across the age groups. And yet we focus a lot on these outwardly behaviors. And we also know that BIPOC kids are more likely to be given a diagnosis erroneously of an externalizing problem than the other kids. So I think that's something that I think about a lot, and also been thinking about intergenerational trauma and communities that faced war and trauma throughout generations, including indigenous communities, including refugee communities, multi-generational refugee communities. There's been a lot of talk, obviously, in the media lately about refugees. For a long time, the U.S. was actually a host of a lot of refugees, and in the recent years, the recent administration cut back a lot and almost like completely obliterated the refugee program. But I think that we're going to start seeing more refugees coming. And I don't think we have a lot of services and programs for refugee children. And I think that's a community that needs to be paid attention to in child psychology.
Thank you for raising both those internalizing issues and presenting problems that, just as you named, often get overlooked. When I first was doing my training program in graduate school, I told my supervisor, I want to work with the depressed girls. And he just kept sending me conduct disorder boys. And I'm like, did you not get my memo? And he said, children who are depressed fly under the radar. They're not being mandated for services. They're not being given referrals. If you kind of sit there quietly, you can pass through the whole school year. And, teachers are overworked, overwhelmed. The classes are crowded. And so, as you named, the ones that are outwardly demonstrating their distress often are more attended to. And thank you also for naming the realities for youth who are refugees. Dr. Turner.
Yeah, so sort of continuing along the lines of understanding internalizing problems, I think one of the areas that we need to continue to understand is Black youth suicide. And so I think that, suicide is a very difficult conversation, especially in the Black community. And I think for a long time, we've sort of seen it as not being like an issue in the Black community. Suicide we don't engage in that type of behavior. And so I think what we've seen in the last couple of years is that there have been increases in suicide among Black youth, and especially among Black boys. And so I think one of the areas that we need to really continue to understand is what does that clinical presentation look like? And so there is some research that shows that oftentimes, for Black boys specifically, we're not going to see these sort of typical internalizing sort of behaviors. They're not going to be sort of engaged in anhedonia or a lack of sort of interest in activities. They are going to exhibit more externalizing types of behaviors with their depression. So problems with anger and irritability, maybe engaging in some sort of substance use to cope with some of those symptoms. And then we also, I think, see where, because boys are oftentimes socialized to be tough and not experience sadness, that they internalize a lot of things and they don't verbalize when they maybe feel these symptoms. And so I think because of that, sort of this idea of always wanting to be sort of tough and handle things on your own, that they're not going to adults or individuals to seek out help. And so I think we need to better understand how can we understand this clinical presentation, but also how we can better sort of teach them to be able to be more open. And I think
Mhm.
that, because we've been having these conversations more, that narrative is going to shift a little bit in terms of boys being more interested in talking about their emotions and feelings, and that parents are recognizing the need to not sort of handle this sort of rigid script around masculinity norms. And I think, and I hope that, that will change, perceptions around sort of being open to go to therapy and get help. And really, I think for us to think more about, again, social emotional skills in kids and teens, and really recognizing when things are not going well. Because there was a recent study that just came out that showed that specifically among Black youth or Black girls, that when they engage in suicide behaviors, and the study was looking at completion of suicide or death by suicide, that oftentimes that is precipitated by relational difficulties, and specifically issues with boyfriend-girlfriend types of crisis within the 24 hours prior to them engaging in suicide. And so I think that's another area that we need to really talk with kids about. Like, kids are getting into these relationships fairly early, but not really knowing how to navigate when things don't go well. And so I think that's an area that we need to really explore with kids.
Thank you so much for naming that. And I think the discomfort and avoidance in parents and communities can also be held by mental health professionals, of like who we assume is quote unquote strong or fine, or that we don't need to ask about that. And so we can miss it, overlook it based on our own assumptions and our own discomfort. So I appreciate that. I wonder if you both could share, and I know there are a range of interventions with young people, but one that you are particularly fond of or appreciative of, an intervention with children or youth, either from a particular community or for a particular presenting problem. And I'll start with you, Dr. Turner.
Yeah. I apologize if there's some noise outside, if it's coming through. Cutting down trees, it's a perfect time for them to do that.
Oh, it's okay. We don't hear it.
So I think one of the interventions specifically for kids facing trauma and even with depression, I think is really helpful, is trauma-focused CBT. It's not something that sort of I specialize in terms of that, but I know that for my colleagues that do that work and really looking at the research, that being able to do that work with kids is really beneficial to reducing their symptoms around trauma. And even studies showing that for kids that present with a trauma diagnosis, whether that's PTSD, for example, that if they utilize this intervention, that they tend to, there's a huge reduction in symptoms, after the course of treatment. So we do know that that's really helpful in terms of addressing trauma, as well as, oppression and things around racism and discrimination. And I think, some research really looking at sort of the need to culturally adapt trauma-focused CBT. And so there's some work being done by one of my colleagues who's in Georgia, Dr. Aisha Mesker, who's been looking at how do we integrate messages around racial pride and racial socialization within trauma-focused treatment, specifically when it comes to dealing with oppression and microaggressions and discrimination. And so I think being able to utilize the intervention, and for clinicians that work with youth, maybe getting additional training in trauma-focused CBT, and specifically looking at sort of the integration of culturally adaptive versions of that are really important.
Great. Thank you so much for raising that. And there are a variety of, cultural modifications that are being developed. So, important to be tuned into that as we think about our, APA ethics around actively attending to and integrating culture. Dr. Ahmed.
So Dr. Turner stole my answer. I mean, that's the gold standard for trauma. You can steal it. You're welcome. But I do want to, I think it brings us to this important point that, so we have, in terms of, we're thinking about evidence-based practices and empirically supported treatments, and, talking about our ethics, our EPA code, and, we should be looking at empirically supported treatments and evidence-based practices, and that's where we should start from. I think there's two approaches we can take. We can take evidence-based practices and adapt them for the culture, and that's what we're just starting to see see in the research. So we're starting to see CBT and IPT, which are evidence-based practices. And I think there's more and more literature to support IPT being evidence-based practice for various cultural communities, and there's research to show where they've adapted CBT and IPT and put in cultural components into it, like things like for Latinx communities, feminismo, respeto, those kinds of concepts, and integrating them and infusing them into these CBT and IPT. So I think that's one approach we can take. And I think the other approach, and we do need research and we do need funding to adapt the sort of the traditional kind of Western psychology, evidence-based practices, but we also need to study the opposite. So we're talking about decolonizing psychology, or decolonial psychology or liberation psychology. Can we take indigenous concepts or concepts that are unique to certain communities, and can we show that they're evidence-based? And we don't have a lot of literature on that. I'm somewhat familiar. I remember learning about it at graduate school and teaching about it to my own graduate students. Cuento therapy, for example, which is a kind of like a narrative storytelling type of therapy where they take folk tales and they adapt and they present models of adaptive behavior for Latinx children, and it's been found to be evidence-based. So that's an example of sort of the flip side, not taking the sort of the Western treatment and adapting it, but going the other way around. And I want to see more and more of that. So we do, I've heard about hip hop therapy, for example. I've incorporated some of these components in my work with adolescents, especially Black youth, when I was in training in Detroit, and I found it very helpful. I wish we had funding to study these on a large scale, because I do know anecdotally that they work and they help and that they're more effective, especially when we integrate them with other treatments. So those are some things that I want to see more about. I want to see APA kind of supporting kind of the flip way of looking at evidence-based practices.
Absolutely. Thank you for naming that, because there are interventions that emerge from the community, and they are intended for the community instead of an afterthought, right? So the cultural modifications are important, and it's also important to know that we have our own ways of healing, and to, as you have named, to study them, develop them, integrate them, and to know that the interventions are being done. This speaks to a big divide that exists in our field, often between practitioners and researchers. And so we don't have the randomized control studies, but you have people who are on the ground doing the work, and are getting powerful results in terms of from their case studies or qualitative evaluations, whether we look at rites of passage programs, whether we look at spiritual, cultural interventions for youth, for each of the different cultural groups. And some people will say, oh, someone needs to develop something. But as you're naming, the work has already been there. It's about studying it and dissemination, and teaching it in a way that distinguishes the incorporation of culture from appropriation, right? So how do we do that respectfully and ethically? So with that in mind, I'm going to ask you all for a resource. This has been so rich, and I know people want to learn more. So if there are any books or websites or apps that you would like to recommend, to share those. And Dr. Ahmed.
Sure. One resource that I've come across recently that for younger children is Sesame Street Workshops has a lot of resources for children and families dealing with grief, and also those who are dealing with racial violence. So if you just Google Sesame Street Workshop racial violence content, it'll come up. And I think that there's a lot of videos about how to talk to your kids about racism, racism, racial socialization, how to talk. There will be work we've heard coming out about police violence as well, and then there's a lot of content about grief. So I think that and it's I think it's for caregivers as well. And then I'm a research associate at the Family Youth Institute, and on our website, it's the FYI.org. There's a lot of toolkits about how to talk to about racism and grief, and it's for practitioners as well as for caregivers, so and parents and caregivers, and I'm a big fan of just sort of media and using media to have these discussions. So then, and comedies specifically, I think there's a lot of shows right now that that talk about these very powerful topics, whether it's Blackish or Gentified or Reservation Dogs. Now is a new one that that's taking a really good look at a community that most of us don't know a lot about. At the indigenous communities, there's Rami, there's Fresh Off the Boat, and a lot, there are episodes about all these various, of trauma, loss, and oppression that I think are very good, powerful, conversation starters that as practitioners we can use, as researchers we can kind of look at some things that we want to study further, maybe things we want to incorporate into interventions and study whether those interventions work. So those are some resources that I can think of.
Wonderful. Thank you so much. And Dr. Turner.
Sure. Dr. Ahmed already mentioned the Sesame Street and Communities resources. They also have an app that's available for kids. So it's called the Breathe, Think, Do with Sesame Street app. So really helping them learn some of those sort of self-regulation, mindfulness types of tools. That's really helpful. I'll also post in the chat, there is a new resource from the National Academies of Sciences, which was created over the course of the pandemic as ways to help both parents and teens to deal with the stressors related to the pandemic. And so it's a very interactive tool that parents can use with their younger children, and for older adolescents, they can use it independently to be able to engage in sort of how to cope with the number of different sort of stressors that they may have experienced. And then I also mentioned, if you follow the Empowered Lab on Instagram, which is run by Dr. Mesker, she provides a lot of resources around sort of trauma-focused CBT, and as well as the sort of coping with racial stressors as well. And she has a toolkit that was created around helping parents and even clinicians to cope with racial stressors. So that's a really good resource. And then my organization, Therapy for Black Kids, we host monthly Instagram live events. So if you follow us on Facebook or even Instagram, you'll get some of those. Our most recent IG Live, we actually talked about suicide prevention in the Black community. And last month we did one that was on back to school anxiety. It's sort of the transition back for kids. So people can check out those videos as well.
Excellent. Thank you so much. And I just want to add to what you all have shared, the National Child Traumatic Stress Network, nctsn.org. They have great resources both for researchers, practitioners, also consultants. I wanted to just name, in addition to trauma-focused CBT with complex trauma, the important work of John Breere, Briere, as well as the importance of parent-child interactive therapy, and then a book I edited for the American Psychological Association, Multicultural Feminist Therapy, Helping Adolescent Girls of Color to Thrive. And in that collection, we really center culture and marginalized girls in particular. So I want to thank you both for joining us, and thank you all who are viewing, both those who view live and those who are watching a replay. I encourage you to share it with your colleagues and also to remember to vote. The election for APA is happening now, and you have until October 28th to turn in your ballots. And I'm asking for your number one vote, Thema Bryant-Davis, for president-elect. Thank you so much, and let's continue working together to help our children to thrive.
Thank you.
You're welcome. Thank you.